In this video, I'm going to talk about CDI nursing, also known as CDIS, Clinical Documentation Integrity, Clinical Documentation Improvement, an old term, or Clinical Documentation Integrity Specialist. I love talking about CDI nursing because this is my specialty. Consider this your career guide to transitioning into a non-bedside CDI role. Hey, it's Emma, founder of Nurse Fern. We help nurses learn about and land non-bedside and remote nursing roles through the extensive resources we host on our website. If you've been interested in non-bedside or remote nursing jobs and you're just not sure where to start because you don't know what the different types of jobs entail, this is the series for you. We're going to cover what CDI nursing is, how to get started and transition into a CDI role from a bedside clinical position, including what experience you need, certifications that CDI nurses have, and things that you can pursue as a non-CDI nurse to get noticed in the field, some items you might want to highlight on your resume to get noticed, who hires CDI nurses, and some examples of companies, titles, and requirements that they have when they posted the roles. This is pulled directly from jobs we've shared on the Nurse Fern job board. We're going to talk about pros and cons and salary insights. Make sure you stick around to the end because I'm going to share a little bit about the day in the life as a remote CDI nurse. I have a quick ask for you. If you're enjoying our content on Nurse Fern and you're enjoying this video, if you could give it a thumbs up, it really helps our small channel and it helps us reach more nurses. What is a CDI nurse? A clinical documentation integrity nurse ensures that a patient's medical record is clear, concise, and complete. A correct and accurate medical record helps ensure that the patient's care team has all the information they need to provide the highest quality care. According to ACDIS, Association of Clinical Documentation Integrity Specialists, CDI nurses apply their clinical knowledge to evaluate how provider documentation, lab results, diagnostic information, and treatment plans translate into coded data. They communicate with providers and other members of the healthcare team to clarify information or provide additional documentation when needed. They educate providers about good documentation practices, including how to document correct disease processes and disease severity, complexity, and acuity with an eye towards accurate medical coding. And they utilize clinical knowledge to report on the impact of complications, comorbidities, illness severity, mortality, case mix, and various procedures on the billed record. A career in CDI is like reviewing charts on steroids. CDI nurses are in the medical record all day, every day, reading through everything as you've probably done as a bedside nurse, looking for holes, what the pieces are, how they fit together, and especially noticing things like this patient got a chest x-ray, the radiologist is saying this, they're getting treatment for this, but the primary physician is not talking about what that could be. That's what really interests a CDI nurse, filling in those holes so that everybody truly knows what's going on with the patient. The biggest function of a CDI nurse that is visible and measurable to the outside world is the query process. And that's when a nurse identifies that there is something that needs to be validated or clarified within the medical record. They will send a query to the physician that includes all of the data they found in the patient record and asking for clarification on what's going on with the patient. It is not uncommon when you land a role in CDI to be completely confused about what you're doing and take several months to get on board and really figure out how to do the job. I'm pretty certain in the first 6 weeks I was sitting there glazed-eyed, not a clue what was happening, but eventually things started to work together and click. It definitely has a fast learning curve and a steep one, but it is not insurmountable. How to get started and transition from clinical to CDI. What experience do you need? While it's competitive to get into CDI as a bedside nurse, it is something that we see happen frequently within the Nurse Fern community. Most often, the track from bedside or clinical nursing to CDI nursing includes transitioning within your facility to a CDI position. It's not uncommon to not know if you have a CDI department at your hospital. Most nurses and physicians still don't know that the department exists within the facility. Some of the things you can do is to look it up on your internet to see if you have a department, ask somebody in quality, ask case management if you see them on the floor. CDI nurses often talk to case management a lot about what's going on with patients and how long they're going to be staying, if the physicians are saying things to them that aren't in the chart. So they're a great place to start to ask if your facility has a CDI department. Most CDI programs do require 3 to 5 or more years of acute care clinical experience. Many do prioritize critical care experience as well. Think ICU, ER, sometimes PACU. but it's definitely not a requirement to have critical care. It just can make the transition a little bit easier, and that's often why nurses are targeted, because they're used to seeing the very high acuity patients and reading through those charts. While critical care is often seen as the most desirable background to have to get into CDI nursing, there are also specialized areas including outpatient, NICU, cardiovascular, and even roles that really want the med-surg level of experience and knowledge. Let's talk about 2 certifications and an educational opportunity for CDI nurses. The most common certification, and usually the first that a CDI nurse, is the CCDS through ACDIS. The primary requirement for this as a nurse is that you have 2 years of experience as a concurrent or retrospective documentation specialist in an inpatient acute care facility using the United States IPPS system. Okay, want. I know that often when we are looking for remote roles or non-bedside, we want to get those certifications first so that we can demonstrate our interest in something. But many of the certs that really matter in these roles are ones that you can't get until you've been in a position for 2 years, like the CCDS. This is very similar to other specialty certifications in nursing, like CCRN, CEN, CPN. All of those require that you have the clinical background to then go ahead and demonstrate that you are specialized in this specialty. That was a lot of specialties. And we bring up CCDS because it is something you will often see on applications as a preferred requirement or even a requirement. So if it's absolutely required, you probably do not qualify for the role as a bedside nurse. But if it's preferred and then the only requirements are the clinical experience, go ahead and look closer at that job description. What might really interest you if you don't have CDI background and can't sit for the CCDS is the CDI apprenticeship course through ACDIS. The CDI apprenticeship is a certificate education paired with a review of core compliance and ethical principles. Candidates who pass the final exam receive a certificate of CDI foundational training and are allowed to designate themselves as an ACDIS-approved CDI apprentice. This designation demonstrates to potential employers that an individual has foundational knowledge of CDI. You will often see, especially if you're hanging out in CDI-specific Facebook groups and chatter within our own group, some nurses go through the apprenticeship because they know that they really want CDI nursing and they want to do everything they can to demonstrate to an employer that they have a strong interest in this field. The third certification, which is really the second certification, is CDIP. CDIP stands for Certified Documentation Integrity Practitioner, and it is awarded through AHIMA, one of the big coding associations. You may see that on a job posting, they prefer that you have CCDS or a CDIP certification. The main eligibility requirement for CDIP is that you have an associate's degree or higher. And this is good news for you if you're one of those nurses that's totally fine going and getting a certification and knowing that it might not be something that you actually get to use because you're using it to try and get the job you want to get into. They do have additional recommendations that you have 2 years of CDI experience, but you don't have to, and that your associate's degree or higher be in a healthcare or allied healthcare discipline. They also recommend completion of coursework in medical terminology, anatomy and physiology, patho, and pharm. So right there, nurses meet a ton of the requirements and recommended requirements for CDIP, excluding the CDI experience. Now, of course, since we're talking about the certs, they do cost money, and I want to make sure you know how much they are. CCDS is $380 for non-members, and the CDI apprenticeship is $295. As a non-AHIMA member, CDIP is $329. Certifications absolutely are not required to get into this field. It's just something that as overachievers, nurses always want to know what they can do to make their resume as good as possible when applying for a role, so we always chat about them. What to highlight on your resume? Especially if you have the really desired experience of critical care, make it super loud and known on your resume. You're going to want to point this out in your professional summary. And within your work experience, make sure your job titles really lead with keyword-specific information that helps a reviewer who's quickly looking over your resume see that you have what they want. So this is what I mean. Instead of using a facility-specific designation for your role, like Clinical Nurse 2, you can make that keyword-specific, especially since facility-based titles don't really translate anywhere else. Somebody who reads Clinical Nurse 2 isn't really going to know what that means, and it might mean something totally different at another place. So I want you to take your specialty and put that keyword in front of nurse. So if you worked in the ICU, this could look like critical care nurse. It could look like intensive care unit nurse. But you want to make it really, really obvious what you do and that you meet requirements that they had in a job posting. Nurses often heavily rely upon the responsibilities of their role for what they use as their bullet points on a resume. I want to flip that a little bit and encourage you to use your accomplishments. You're going to have to stretch a little bit beyond patient care, but think of those things that you did even while on shift that were above and beyond your bedside clinical responsibilities. Especially with CDI, I want you to highlight if you did any data abstraction, chart checks, or auditing within your facility. This could be something as simple as doing chart checks to make sure that nurses had proper restraint documentation, that they were doing Foley care, skin checks, central line labeling. All of these show an eye for detail and that you were interested in quality and elevating patient care. If you need more assistance with your resume and a little bit of guidance for how to make it stand out for remote positions, make sure you check out the Nurse Fern resume template, and it is linked in the description below. Who hires CDI nurses? CDI nurses most often are hired by acute care hospitals, but you will also increasingly see roles with insurance companies and then secondary staffing groups that contract with facilities to do their CDI nursing. A few examples of companies and the titles that they had that we've posted on the Nurse Fern job board include United Health Group, Clinical Documentation Integrity Specialist, and they required likely a license in your state of residence and then 2+ years of acute care hospital experience. So they didn't actually have a requirement for the type of experience. They may have gotten more specific in the preferred qualifications, but for the basic ones, they just wanted you to have 2 years of acute care. Cleveland Clinic, CDI Specialist 1. They required an Ohio registered nursing license and a minimum of 5 years experience as a hospital inpatient nurse or hospital inpatient coder. West Virginia University Medicine, CDI Specialist Inpatient, RN or LPN. Requirements, 3 years for RN, 4 years for LPN, in outpatient ambulatory or inpatient acute care setting. Ensemble, RN Clinical Documentation Specialist, RN in the US, BSN, 5 years acute care nursing experience with specific medical, surgical, intensive care, or emergency department experience. Virtua Health, CDI Specialist, RN required, ED, ICU experience, or previous CDI experience a plus. Okay, this one's a little bit longer, but it has to do more with where they're hiring. Marshfield Clinic Health System, Clinical Documentation Integrity Specialist, ADN or BSN, 5 years of recent adult acute care experience in medical, surgical, critical care, emergency room, operating room, PACU, case management, or utilization review. And then they even mention at the bottom that the ACTIS apprenticeship is preferred. When I'm updating the Nurse Fern job board, I open every single CDI position that I see come up in my search. I know this is one of those highly in-demand roles because it is more introverted and you tend to have more flexibility than with a patient-facing position. So I look every single time to see if I can find something. CDI nurse salary ranges. According to salary.com, CDI nurse pay ranges from about $64,000 to $92,000 a year, with an average right around $78K. But one of my favorite things that you have access to is the ACTIS CDI salary survey. I've linked it in the resources. Even if you're just looky-looing, I highly encourage you to click that link and check out how CDI nurses are getting paid. It is really enlightening to be able to see the difference between the regions, the education level, how long a nurse has been in the profession of CDI, how long they've been a nurse. This is something that I don't see other specialties really drilling into on pay, and I think it'd be really cool if they did. One of my favorite things that they've included in this year's salary guide are questions about remote work. Pros and cons of CDI nursing. Some of the biggest pros have to do with the schedule and that you get to work during normal business hours. So there's no more overnight shifts. You're not working overtime for the most part unless you want to. And you're really able to have a little bit of flexibility with most positions. You often have the potential to work hybrid or even fully remote, even for your acute care facility. You have the opportunity to really strengthen your critical thinking skills and use all of that nursing knowledge you've built in your acute care experience for this new specialty. And as you learn and grow as a CDI nurse, you really gain additional insight into the patient journey and how everybody looks at and uses the medical record. I 100% always say that if I went back to bedside nursing now, I would be a better nurse for my experience in CDI. All right, so the cons. CDI definitely isn't for everyone. It is a very chart-heavy, quiet position. There is not much interaction with other people unless you have a designated meeting with your team or you're chasing down providers to find out more information. You will be on your computer reading charts until you are through your queue or what your metrics are designated for the day. At times, providers can be a bit of a challenge, either because the lack of knowledge surrounding the CDI department and how it helps patient care hasn't quite made it to that physician, or because of something that's happened in the past past, they either don't agree with the mission of the department, or they just don't really have the time, they're busy, they're overburdened, and they're not able to answer your queries for you. The CDI nurse needs to be really good at managing relationships between the team and providers. So some will find the autonomy of CDI nursing to be extremely appealing, while others will find it to be isolating. It definitely requires discipline to stay on task and to meet daily metric requirements. All right, thanks for sticking around and making it to the bonus, which is a day in the life as a CDI nurse. As a CDI nurse, I personally would wake up in the morning and pretty much roll through my kitchen, grabbing a cup of coffee on my way to my desk. I usually worked the first part of my day in pajamas, so that once I sat down with my coffee, I was logging onto the system and starting to look at emails and then opening up our EMR and then also our other documentation system, which was our coding software and how we sent queries. After signing on and reviewing emails, making sure I replied to anything urgent, I would go into our system and select the patients based on our requirements that I was responsible for the day. Now, my queue consisted of new patients that had never been reviewed by a CDI nurse, coupled with patients who had already been reviewed that I needed to go back through for more information, see if there were updates. Maybe I was watching to see if there was a query that needed to be sent. So the vast majority of my day was reviewing patient charts once I had gotten my queue set up. Now with each patient chart, I would review all of the information that I hadn't seen before. So if it was a new patient, that would be the entirety of the chart, including any results, communication, things that were scanned in from outside providers, and make sure that there weren't anything within the chart that needed to be queried. This would be a repeated process for all of my charts for the day. We were required to review anywhere from 10 to 25 charts, and this varied depending on our metrics and how we were doing throughout the year. You'll often find that a metric that isn't exactly held to, but is a general guidance based on data from what other nurses have done, is that throughout your day, you'll get about a 20% query rate on the charts you review. So if you review 10 charts, you'll probably send at least 2 queries. I had the ability to flex my start time. I could really start anywhere from like 5 to 9 a.m. if I wanted to, as long as I worked 8 hours. I also had the flexibility to take a longer lunch if I wanted to get out and go on a longer walk, or if I had an appointment or something else that I needed to take off during the day, I was able to say, hey, I gotta go for this amount of time. I'll be back and I'll finish my 8 hours for the day. We didn't have a lot of contact within our team, but our team personally really enjoyed each other. And so we found little ways to text or communicate on Teams throughout the day to stay in touch and have the ability to collaborate and ask questions. On our team, all of us came from different backgrounds, so it was really helpful to be able to say, hey, I've got a weird question about neuro, and you were a neuro ICU nurse. Can I run this by you? And alternatively, somebody might come to me and be like, hey, I've got this weird ER note, and I'm just not sure what happened. Can you take a peek? And once I was done with my charts and with my 8 hours for the day, I would log off, turn off my phone, and walk out that office door and not think about it again until it was time to sign on the next day. Thanks for hanging out and learning about CDI nursing with me. Make sure you check out the next video to learn more about remote nursing.